one of the early starting points springs to mind where facing that challenge of where on earth do you start, of course you start small, and one of the teams in my organisation, the cystic fibrosis team, came forward and said, we've got a problem. Our patients are waiting too long in the clinic environment, and if you've got cystic fibrosis, being in a hospital environment when you don't need to be there is not a great thing. And they made it quite human. They said that we see our patients bringing books and magazines to read, and that's not great. So our team were able to provide them with a coach to coach them through an improvement project. And I think there was something very important, because from the start they had ownership of this. This was meaningful to the staff, and they brought their patients in and involved them in the changes and measured to make sure that those changes were improvements. We didn't ask them to buy into anything, it was their ownership, and that group of staff in the cystic fibrosis clinic reduced their waiting time from about 39 minutes down to under 12 minutes on average for each patient. Something unexpected happened. They had about a 20% not show up rate, did not attend rate for that clinic. Now, they'd set out to improve their clinic to take down the waiting time, but by doing that they had created a better patient experience, and their did not attend rate, their fail to show rate, dropped from over 20% down to under 9%. Now that's really exciting, because actually the hospital doesn't get paid when a patient doesn't show. So although they started with something that was meaningful to them for their patients, actually they've increased the efficiency of their clinic. When I reflect on this, I flip it round. What if we'd gone to that clinic and said, you really need to save money? I predict we wouldn't have had the same traction with improvement science capability there.